So what's going on, Phlebotomists? Hey, can you guys hear me loud and clear? My name is Khalil Thomas, and we are here in the Phlebotomy Secrets Podcast. I am so excited. I'm so hyped. We're finally here. We're like really getting this going on. So please drop your names in the comment section. Who is all in here? I would love to see who's all included. And listen, we're going to get this thing started. So let's jump right into it, Phlebotomists. First, I want to thank everyone for just being so patient, everyone for just, being so excited that this is actually happening for us phlebotomists. We're actually creating a platform for us to speak up, talk, engage. And I think it's so important that we have a platform like this because usually we're not really heard, okay? We're not really respected. And that's what we're going to be talking about today. So if you guys want to jump in and actually chime in and ask any questions, or if you guys want to have any input on any of the thoughts that I'll be saying, please chime in. It would be great. So who's all in here? Hey, what's going on? Logged in on the road. Okay. Make sure you're driving safely. Okay. Make sure you guys are dropping your names too. I can't see your names on here, but I would love to know who's all involved, who's all listening, because we got some things to talk about. Okay, phlebotomists. My first question to you all is, have you guys ever felt unappreciated in this healthcare field? Comment me. And I'm talking like from doctors and nurses, other healthcare professionals. Do you feel like you were just like not appreciated at all? Do you feel like you were in a situation to where you were just like undervalued? Do you feel like you were in a situation to where your opinion didn't really matter, or you just felt like you weren't respected within, the healthcare system only because you were a phlebotomist, And I'm asking that only because I feel like a lot of the times when we're in entrepreneurship, people don't, or phlebotomists, I should say, feel like they don't have a voice or they don't have, a say-so in things, which kind of crutches them on reaching out to doctors for partnerships with their laboratory or their mobile phlebotomy business or talking to higher ups. Do you guys ever feel that way at all? Do you guys ever feel like you're not respected in the healthcare, system, or you feel like other healthcare roles don't respect phlebotomists? I would love to know and hear your thoughts on that, only because, again, we are important. We are needed. We are healthcare professionals that, value patients' results, their veins, the whole entire procedure, because if we do something wrong, their results are wrong, and then we have to redraw them, restick them again, and it's like a whole entire process, okay? So I would love to know, what do you guys think about that at all? Do you guys feel like, hey, we're in this business as phlebotomists, but we're not really heard, okay? And we're like pretty much the most important healthcare professionals out there for these patients, only because we have to draw their blood. We have to get into the veins. We have to use certain needles. We have to mix additives. We have to process these specimens. We have to make sure that we can't even keep the tourniquet on for more than a minute, because hemoconcentration can happen, so it's more in depth than what a lot of people think. You know what I mean? Because I feel like you guys seen it. Doctors drawing blood, nurses drawing blood, LPNs, medical assistant, but no one's drawing blood like a phlebotomist. Heck, I remember one time I was actually watching a doctor draw blood on a patient, and she had the lavender tube, being taken out of the patient's arm, but she still had she still had the PT-INR in her hand, the blue top tube. And if you guys know the orders of draw, we're supposed to do the light blue tube before the lavender tube. So I'm just watching and I'm just like, wow, like, do you guys not see how important it is for a phlebotomist to do these draws? How important it is for a phlebotomist to actually, do their job and what they're trained to do, because anybody can pick up a needle, and we all understand that and know that. But do you know how to make sure that the specimen is safely sent over to the laboratory? The integrity of the specimen is done correctly. Are we making sure that their additives are being mixed with the blood? Are we making sure that we're inverting the tubes? So it's more than just drawing blood, and that's my point. It's more more involved, and it's so important because if we don't do these things right, we have to redraw these patients. We have to redraw these specimens. We have to just do this whole entire process over. And it can be so tedious. It can be so long. And it can be really, really bad for the patient too. And now the patient doesn't trust you or trust your laboratory that you're partnered with because he or she thought that you got the blood, which was fine, but we didn't even invert the tubes correctly. We didn't even mix the additives correctly. We left the tourniquet on for too long, so the specimen's, bad. So we have to understand that a phlebotomist specifically is important. We are more than just drawing blood. We are the frontline healthcare workers that are going to give you the specimens that you need to diagnose your patient or treat your patient. Can we all agree to that, right? Because again, about 90%, I'm going to say 80% of doctors rely on these blood tests in order to diagnose and treat these patients. You guys know that? Did you guys know that? Wait, we are the people that are supposed to be giving these doctors these results. So we can't have faulty results. We can't do these procedures wrong and not know what we're doing. We have to know the orders of draw. We have to know this stuff in order for these patients to get the right results, in order for these doctors to diagnose this patient and treat this patient and to be able to give them the medication that they absolutely need. So it's important to know that we are phlebotomists and we play a huge part in the healthcare system, more than what a lot of people think, and I feel like a lot of the times when we're in this healthcare field, a lot of doctors, nurse practitioners, a lot of healthcare professionals already have the scope of practice, which is phlebotomy, under their belt already. So they feel like because they already have phlebotomy underneath their belt, they may not have went to school or went to training or even seen as many patients as we have that were hard stick, deep veins, rolling veins, spider veins, patients with edema, scar tissue. They haven't seen as many of those patients as we have because their profession is like further ahead than us, which is okay. That's what they, went to school for, and that's what they further their education for. But we have to remember, we as phlebotomists see all of these types of veins in patients, okay? So that gives us different technique, different movement, different approach, right? So we're in this place. We have skill, okay? Exactly what we're about to get ourselves into when we're drawing these patients' blood. But as far as doctors, LPN, nurses, and I'm not taking nothing away from them. I'm not saying anything bad. All I'm saying is our job is so much more important than just picking up a needle and drawing your blood, okay? We are the healthcare heroes. We are one of the top healthcare personnel that is going to get you your results that you need. Not like a doctor, not like a nurse, not like an LPN, not like a medical assistant. We are phlebotomists, and we're going to do our job and show you our skill that we can get this specimen done the right way, okay? So phlebotomists, I want you to remember, when you're dealing with doctors, nurses, and everyone else that's higher up in the healthcare profession, whenever it comes down to drawing blood, I want you to remember that they do have a scope of practice where they're either diagnosing, offering medication to patients, but they can draw blood. They can perform venipunctures, right? Because that's all underneath their scope, but they're not really focusing on that how we are and how we have been, but they're able to do it. But does that mean they know phlebotomy? Does that mean they know how to have integrity for that sample? Does that mean they know that they should have that specimen sit for 30 to 45 minutes before they have it spun in a centrifuge? Like, do you think that they know that stuff? Because I don't think they do. I don't think they do. I saw someone actually centrifuge a specimen 2 or 3 times because they didn't let it clot. And because of that, hemolysis happens. And they don't even know what that means, what it is, So I say this so clearly and huge because it's those small things that really do make a difference. And it's actually a statistic that people that are not phlebotomists that perform venipuncture are more likely to have a bad specimen sent over to the laboratory. The percentage is really, really high because they can care less. As long as they're in that vein and as long as they're getting blood out, they feel like they performed the venipuncture successfully. And that's not how this works. That's not how this happens. That's not how any of this is supposed to be going on as far as venipunctures, okay? Because there's so much to this, okay? So we have a gift. We have a power. We have a skill. We have something that a lot of these healthcare professionals don't really understand. The next person that you talk to that is drawing blood, that is higher up, I want you to ask them, what's the orders of draw? Ask them what's the first 3 tubes you should be drawing, just to see where they're at so that you can see that not everybody can do what we're doing. And you say it in a humble way. You don't have to be mean about it. You don't have to be discouraging or anything like that, but just open your eyes to see how important we are or how educated we are in these specific places of phlebotomy so that we can also educate our higher ups too, so that we don't have these specimens sent over to the lab wrong. Okay, it's all about integrity. If you see something wrong, if you see something is invalid, or if you see something that this person or medical personnel should be doing the right way, we should be telling them. We should be educating them, because again, you can draw blood with no problem. You can pick up a needle, you can, perform the venipuncture into the patient, but does that mean you're a phlebotomist? Does that mean you have phlebotomy skill? Does that mean you're an expert at venipunctures? Because I don't think so. I don't think so. There'll be times where you see somebody, they don't even know what taunting the skin means. They don't know, when to pull out of the vein so that you can actually get that needle into the vein so you can get a flow. They don't know about hemolysis, hemoconcentration. They don't know about the additives that are inside. I'll ask a person, hey, do you know why this blood is moving inside? They're just like, I don't know. And I'm just like, well, there's EDTA inside there, so it won't let the blood clot. So that's why it's able to move around that too. But it's small things like that that we need to start to educate our medical personnel about, because again, you're able to draw blood, which is great, but we have to make sure that we have integrity for these samples, okay? Good morning to everyone too. I see you guys on the comments and the chats. Hey, you guys, what's going on? So yeah, I just wanted to definitely talk on that because I think it's important, and we need to speak up more whenever it comes down to integrity of samples. We need to speak up more when it comes down to seeing other professionals do venipunctures and they're doing it the wrong way. And we need to start speaking up on how to do it, why things are done the right way, how to use a centrifuge, which is a big one. They don't know how to balance, centrifuge. They don't know what types of tubes should go inside of a centrifuge, or why you're even centrifuging certain tubes. All of this is so important. So that's why phlebotomy is more than just drawing blood. Can we all agree to that? Phlebotomy is more than just drawing blood. Can we agree to that? Yes or no? In the comments section, can we all agree to that? Because it's so much more to it. It's so much more. And I'm hoping that a lot of these schools are teaching this as well. Now, I'm only saying that because I'll see certain students do certain things. I'm not, pointing anybody out specifically. Maybe they're going to learn it later down the line. But we need to understand that the patient is always going to know their vein as well. I see a lot of the times people are missing on the first shot because they're not listening to the patient who knows their vein. So they're going to tell you where to go. And once we're in that vein, we're able to actually get a flash or a draw. We collect that sample, we have it sent out. But in these schools, I'm seeing that a lot of the times these students aren't understanding that side of phlebotomy, which is okay, because it's all going to be situation. I know that we're dealing with students who may have great veins, who don't have to tell another student where they need to go, but it's certain things like that we need to look at and start evaluating, because we have patients that are going to have edema. So school should be teaching them strategies on how to press down on certain patients' hands or arms so that we're able to see the vein so that we can successfully draw it. Or patients that have scar tissue, because we don't have those students with scar tissues, right? So how do we actually get exposed to those situations? You know what I mean? But that's what makes us the most experienced. And I feel like whenever we're in situations to where we're job searching or we're getting a specific job somewhere. I feel like the hardest place to work for venipunctures would be the best experience any phlebotomist can actually get. And anyone can agree with me. Methadone patients are probably one of the hardest patients to actually draw because they're users. So they're going to see any vein on their arm and use it, and eventually it collapses. It's scar tissue. It's hard for us to get, but that's what makes a phlebotomist so great at what they do, because we're able to get to those specific veins because of those hard stick patients. So I want students to get used to looking for those hard stick patients so that they can get the most experience from those situations. Because if you can draw a hard stick patient, you can draw anybody, literally anybody. So I definitely, want to express that, because again, not everybody's going to understand that. Not everyone's going to get that, because again, there's levels to phlebotomy. And I explained that in the last video. Level 1, again, that's position. Next is going to be permission from the patient. Next is going to be production, which is the actual script that you're going to be producing to patients. Next is going to be patient development. So a person wants to actually be like you. They want to become a phlebotomist. They want to learn from you. They want to actually, go to school and start doing draws. So they want to be like you. They're inspired. And I know that's happened to a lot of you guys that are watching this. Has it ever happened to anyone? Comment the word yes, because that's what level you are possibly on or headed to. Because if a person is inspired by what you do or how you do things, they want to be like you, right? And then level 5 is going to be patient development. Patient development is going to be where everyone knows who you are based on your credibility, your word of mouth, proof of concept, reviews, testimonials. And this is what everyone needs to be reaching for, is that level 5 phlebotomist, okay? Just to show the world and your patients that you know what you're doing, you know how to do it, you know when patients need to be stuck, where they need to be stuck, how it needs to be done, the size gauge needle. All of this is so important when starting not only your mobile phlebotomy business, or just being the best phlebotomist you can possibly be. So we're going to push for this. We're going to advocate for this. We're going to keep this light going on for phlebotomists, because again, just because you pick up a needle doesn't mean you know how to do phlebotomy, okay? That's huge. That is huge. Good morning to you as well. Thank you so much, you guys. I'm so happy you guys are actually joining. Does anyone have any questions at all? Anyone have any, say so, want to, chime in? Just definitely leave your comment in the comment section. I'll be gladly to respond back to that. Again, phlebotomists, we are one of the biggest heroes in the healthcare facility. Don't let anyone else tell you otherwise. We're big, we're huge. We're one of the most important healthcare personnel out there. And we gotta keep talking. We gotta keep letting people know. We gotta let these professionals understand that, we have a big part in the healthcare field, especially to patients, okay? Because if we can't get to the vein, what makes you think that you can and then have that specimen sent to the laboratory correctly? You see? Because again, you can draw blood, but do you have integrity for that sample? Do you have integrity for that blood collection or that patient? All right. And that's going to be the most important part of, being a phlebotomist, is understanding that. We have to know the orders of draw. We have to know the additives. We have to know that we have to let this blood clot. We have to let the blood clot. Okay. So if you're at any facility right now, you're drawing blood, whether it's an SST or a red tube or any type of tube that you have to have sitting or clotting, I want you guys to know that you guys need to have that specimen clot. And you need to have a timer, 30 minutes, 45 minutes, okay? I know that some people actually put the tube upside down so that they say that it clots fast when you do it that way. I don't know, it's like a myth. But we need to have these samples clotted, okay? And it's small things like that that really do make a difference for integrity for the sample, okay? So yeah, phlebotomists, we are important. We're not going anywhere. We're going to continuously be phlebotomists that are going to be the frontline workers. And we just need to start speaking that into existence and showing other healthcare professionals how to do it the right way. Okay. So I'll be talking to you guys later, phlebotomists. Thank you so much for joining in on this. I'll be having another live session so that we can talk just more specifically on phlebotomy topics, understanding, what we do and how we do things and why we do it, okay, as phlebotomists, okay? I see a question. That's exactly what happened to me. I sent the phlebotomist to get a PT and they feel that what? Are you serious? You guys see this? This is crazy. Okay. So you sent the phlebotomist to get a patient and they feel it halfway. I'm assuming it was a PTINR. It wasn't to the line. We need to have those PTINRs or those blue sodium citrate tubes. They need to be to the line. Okay. Usually people use discard tubes. Some people use the red top, or some people use another PTINR, but you need a discard tube so that you can get that air out of that sodium citrate tube. Okay, that's so important. Okay, again, we have to have integrity for these specimens, phlebotomists, and we need to let other professional doctors or nurses or whoever's drawing these patients, they need to know that we need to get up to this line, and in order to get up to this line, we need to understand that we need to have discard tubes for these specific types of tubes, especially the sodium citrate. That's huge. So huge. Okay. But that's awesome. All right, you guys. So thank you so much for tuning in again. This is great. But we will be talking again soon so that we can just, talk about these problems, issues in phlebotomy so that we can make a change in our industry. And I'll be talking to you guys later. Have a great day, phlebotomists.